ARID Lab is part of the Division of Pediatric Cardiology in the Department of Pediatrics at the University of Arizona. At ARID Lab, we are committed to sharing the valuable information generated by our research projects with the community in an easy-to-understand format. This video, and others like it, are made to provide a straightforward explanation of our peer-reviewed research results published in scientific journals. In this video, we will be summarizing the results of our recent research article on executive function and maladaptive coping in a young adult cohort of individuals with congenital heart disease. A congenital heart defect, or CHD, is a physical defect of the heart that happens while the baby is developing in the womb. There are many different types of CHD, and some are more serious and urgent than others. The most critical are called severe birth defects and require procedures, hospitalizations, and surgeries during the first year of life. Often, these babies are born looking blue or purple. Other factors that indicate a baby has a severe CHD include open heart surgery and long hospital stays requiring interventions. People with severe CHD are at risk for neurodevelopmental delays. Neurodevelopmental delays are problems with thinking, understanding different types of information, or learning how to use information. As a child grows up and becomes an adult, these problems remain and are known as executive dysfunction. If the delay was not bad enough to get caught as a child, then you have someone with a severe CHD who might not even know they have an executive dysfunction as an adult, and instead, they start to believe they aren't smart enough or are just not good at certain things. Along with having trouble planning, an inability to stay motivated, or problems with emotional regulation. We think that people living with severe CHD are more likely to experience anxiety and depression, but when you ask them how they are doing, many times they report being even more healthy and happy than someone who does not have any chronic illness. This doesn't make sense, as chronic illness has physical and emotional effects on the body, and all the extra responsibilities that come with it make life that much harder. It's possible that people with CHD are tired of being sick and convince themselves that they feel great even when they are having issues that should be managed. This makes it hard to know how many people with severe CHD are struggling and need help and just don't ask for it or talk to their doctors. The research team at the University of Arizona has conducted a study to better understand how young adults with CHD make decisions and how that related to their general emotional and physical health. We wanted to know if young adults with CHD were experiencing executive dysfunction and how they deal with it. We did a mixed method study that included questionnaires that gave us scores for the different things we wanted to know about. We asked about stress specific to their CHD, their overall health, and executive function. We wanted to get a deeper understanding of how people were feeling and what their thinking process was, so we also did interviews. We had 11 people fill out the forms, and 5 of them also agreed to be interviewed. We found that people with severe CHD are more likely to try and ignore the stress caused by their condition by avoiding dealing with it, letting their body deal with the stress, or just trying not to feel anything at all. Basically, they are choosing not to actively engage or deal with the issue, and this is called disengagement coping. These types of coping strategies are called maladaptive because they might make you feel better in the moment, but not actually dealing with or fixing the cause of the stress. We also found that those who practiced disengagement coping had worse physical and mental health overall. They told us in their interviews they were doing great, but they scored really low in the ability to do physical things and scored high in experiencing pain, anxiety, and depression. Many of our participants also said that they did not tell people they had a heart problem and did not like to talk about it with their friends and family. We found that young adults were at risk for anxiety, depression, and poor quality of life, but they did not acknowledge that they were experiencing anything negative. This had a direct association with their overall health. We need to teach our children and adolescents with severe CHD how to recognize and properly address health issues that are happening. We also need to do a better job in recognizing that they may be struggling with decision-making and help them develop good, healthy coping strategies that will improve their quality of life. We think that pretending not to have a CHD is causing a lot of harm, and we can help these individuals live a healthy and happy life by talking to them early and often about how to manage their CHD and let them feel like they don't have to hide their condition from people. To find out more about this study and others, visit the ARID Lab website at aridlab.arizona.edu.